Thank you very much for the introduction, Andrew, and also for the organizer for giving us this opportunity to talk about some of the initiative that is underway by Heart and Stroke. And I just wanted to say that, sorry. Okay, I just wanted to say that when I cut off, just let me know, because my voice do not project. There is this joke that if I get lost in the middle of the lake, no one will rescue me, because no one would be able to hear from me. So, but one thing I do want to seriously want to say is that, the purpose of sharing what we're doing today is really wanted to let you know that, how can we work together? How can we not reinvent the wheel? And how can we partner together to drive the most impact and be most consistent so that our voice can be heard in this particular area. So there's three main areas I want to touch on in the next little while. One of them, the first focus that I want to talk about is our data and knowledge translation piece. And Stephen has very nicely just kind of quoted some of our current work. And really, we believe in data and knowledge is essential in guiding our actions. And it's also a way to convince the municipal to make changes. We work closely with ILCOR on the development of resuscitation guidelines. Joining with CIHL, we also funded the Canadian Resuscitation Outcome Consortium, which many of you are very familiar with. And lastly, in addition to the investment in CanRock, we also continue to fund peer-reviewed research program that not only look at the solution of AED, but try to really better understand, what is causing sudden cardiac arrest, what are the barriers to implementation, really better understand, the bottom line of all this work behind it, all this barrier and unknown research question. And I just want to take this opportunity to also introduce you to find out more about all the work we are doing in terms of funding sudden death related or AED related research. You can visit our very newly launched website. It's only 4 days old, so it's a baby. It's an interactive research map where you can type into the research of topic, and then you can connect with the researcher, because guess what? Writing a grant together is the first step to solving this problem. Complementary to our external research funding, we also conduct a number of in-house research on heart and stroke. Here are two examples, one of which Stephen have very nicely mentioned. With the support of CanRock, we were able to use the data, real-time data is being collected right now by 3 CanRock sites to develop model to better estimate the incidence of cardiac arrest outside of a hospital. The results from this study will allow us to more accurately quantify the health burden of cardiac arrest, and also better relate those information to the politicians so that they can actually drive system change with us. And a related study is the cost effectiveness of public access of automated external defibrillators in Canada. Again, when we're going to talk about system change and policy change and advocate for this, so that people can listen to us, as we have heard from Jordan's Foundation's talk, that it's hard to get people to listen to us. And so we need to go in and be prepared to talk about what is the actual cost, and how can we actually determine under what circumstances that is feasible for us to find a solution in a cost-effective way. Second area of focus for heart and stroke is education and training, specifically on CPR and AED. Through our courses, we have trained 215,000 people each year in Canada, how to do AEP, how to apply CPR, and how to use the AED. We also provide comprehensive instructor network to support our 11,000 instructors through our online training portal. And many of you are probably very familiar with our Resuscitation Portal, and we continue to expand the wide variety of courses that we can offer at different proficiency level. And I do stress the proficiency level is important, because we need to expand the number of people to be comfortable with actually applying this very feasible solution right now, while we find a more longer term solution on how to screen and identify those who are at risk but not obvious to us on the get-go. The third area of focus is our advocacy and public awareness efforts, which both through the Jordan Foundation talk and Stephen talk, and also earlier on this morning, that we have talked about how important it is for everyone, not just the physician in this room, not just the health professionals, but also everyone outside of this room is aware of. We talk about primary care in our first Q&A. I'm sure there's much more discussion to have. So what we have really put effort in is, creation of awareness and health information resource on our website. A lot of them are for the general public, and we also have developed some that are more specifically for our health professionals. As well as our most recent efforts called the Restart Our Heart initiative that some of you have been very actively involved or have heard of indirectly. So what is this initiative? It is a multi-pronged strategy to increase the number of cardiac arrest survival through bystander CPR, and also to boost greater use of AED. And I hope that particularly this audience, it really does fit into, this beautiful framework that's been outlined in the position statement, that it's the foundational piece where the Restart Our Heart Day is helping out, and is a very integrative kind of approach to help this greater community here. Our focus is on changing the overall system, which means by engaging both the government and the public. In terms of the goal of the government engagement, as you can see here, is really to advocate for legislation changes and to really drive for implementation of policy where it really gonna help us to make AED more accessible, more ready, and more available. And as we have heard from Stephen talk just a couple of minutes ago, that the AED itself alone is not good enough, and the people alone training them is not good enough. So really trying to drive that framework where how we can bring the public together right at the beginning as well, just so that when both two pieces are ready together, they're actually going to make a change, and the action that's really going to reduce the cardiac events. Our goal is to make AED readily available and people in Canada to be rescuable. And I just want to really to emphasize that this is not an initiative where heart and stroke staff is going to go out there and place one AED at a time, because we all know that is going to be taking too much time. But really, it's a systematic approach where we want to rather drive system change by focusing on 3 areas: the recognize, respond, and report, the teaching, the educating, and one last one that we haven't done so much on is the system performance change. So how can we monitor? How can we continue the surveillance? How can we continue to kind of see what progress is made, and doing that adjust the course of our action? Again, going back to the data and the evidence-driven part and reporting back to the community, consult and continue the effort. We're in a process of developing a recommendation to the government. All our provincial staffs and national staff are working very hard trying to figure out what exactly would be the relevance that asked to each of the provinces. As you're aware, there is a federal election coming up very soon, and therefore we really need to adjust for what's the outcome that could be. But on the very high level, I can share with you today that it really revolved the 4 key areas: to no surprise, education and awareness, AED accessibility, readiness, and availability. To Stephen's point, if you have to punch in the code to get your AED, that's not going to help. If your AED is, in the top floor of the building when they're closed in the evening, when there is potentially most risk of having cardiac arrest, that's not going to help either. And really lastly, going back to that quality improvement and also integration to the overall system, does your AED registry connect to your EMS system? Does it collect those data and report back to actually tell your emergency doc how things are going? Does it report back to some other important part of the stakeholder in the pathway, that's so that we can drive overall change? This is the beginning of a long journey. And to start, we have done some environmental scans through the provinces to really understand what are their priorities and how we can provide or work with them to identify solutions that fits their unique context of political environments. For start, we know that Manitoba has the most comprehensive legislation in Canada. They have an AED registry that is linked to the EMS response system for many years. Ontario and Nova Scotia, a little bit more lukewarm. We have some AED liability exemption. There is some traction, there's kind of interest on other possible measures. Quebec, we know that they have the Charter of Human Rights that to protect people about that, the fear of liability, so that people are mandated that they have to help someone if they're in need. and the work will continue. So to complement the advocacy work, the government engagement work, the second component of the Restart a Heart National Initiative is boosting awareness. And again, going back to my first point, let's not reinvent the wheel. Let's not have a standalone campaign and spend a lot of donor dollars, but really join the global movement that already exists, leverage our existing partners and stakeholders. So on October 16, we are going to be joining this global movement called the World Restart a Heart Day. It is an initiative led by ILCOR, but Heart and Stroke is a member of representing Canada. And what we're going to do is really trying to focus on boosting the awareness and education piece of this through the social media channel and by using hashtag World Restart a Heart Day. And with that, I know we are here to look for the long-term solutions, how we can find those who are at risk so that we can prevent what happened to Jordan. But today we can do something. And I want to invite all of you in the audience and your family and friends that on October 6th, you're welcome to use a social media toolkit and any all sort of resources that we are available on our website to help promote this, this important message on your respective social media platform. And for any of you who are interested in receiving this toolkit, I'll be happy to share that with all of you as well. And lastly, social media channel is just one way to getting the message out there. And I remember this morning we were having breakfast, you know, Paul and Stephen, and on that table, we were talking about how important the digital space it is, right? People tweet messages and it drives a lot of movements. So with that, we also developed some key messages to share with the public to empower them. The focus here is help them to be effective self-advocate. As we have heard from the first talk in this section, it's hard to get people to understand us. So we have generated 3 lay language message for all of us to disseminate. I'm not going to read them out because you guys are very, very familiar with it. But I hope with this, we'll have your support to spread these key messages. We'll have your support to drive system change. And happy to be partner of and continue to figure out what the long-term goal is. But in the near term, in just less than 2 weeks, I hope we will have your support on the social media channel on World Restart a Heart Day and help us send this message out to the rest of the world.